don't know if I want to be on TV. All that weather brought to you by Carrier. Lara, let's go into you.
Ginger, thank you very much. All right, now to new medical advances in an area I have personal experience with. After seeing my story right here on GMA, one of our viewers reached out and told us how her child was screened for hip problems at birth. Here's a closer look at how doctors are trying to stop the problem early. As an active woman in my 40s, I was shocked when my doctors told me last summer I needed an entire hip replacement. It was so upsetting. I was like, what? Diagnosed with a condition called hip dysplasia, also known as DDH, which led to painful arthritis. My doctor said I probably had it since birth. This hurts. About 10% of all hip replacements are due to this problem. But advancements in medicine are making hip replacements due to DDH rarer. Today, every baby is screened for DDH, and when detected, early intervention helps avoid surgery later in life.
Hip dysplasia is one of the more common congenital things that children are born with. So it is an important part of the newborn exam, and there's a lot more awareness and discussion on it because it is treatable.
Some newborns are at a higher risk, like those with a family history of DDH, and babies who are breech or born with a dislocated or loose hip. And a simple ultrasound can reveal the problem. 1-year-old Emily Mensch was born breech and diagnosed with DDH at birth.
The doctor at the hospital were checking her legs, just routine screening, and felt like one of the leg, he was able to pop it out of the socket, so they described it as a shallow hip socket.
She was given a Pavlik harness at just 2 days old and wore it 24 hours a day for 2 months to reposition the hips correctly. Now doctors say she is on track.
She's got a clean bill of health. She doesn't expect that she's going to have any hindrances in life, which is really a great outcome.
And ABC News senior medical contributor Dr. Jen Ashton is joining us right now. So what symptoms should parents be looking for?
So as we saw in the piece, and parents listening should be clear on this, this is part of normal routine newborn screening. And just because a woman has a baby in the breech position doesn't automatically mean their babies will have this. It's just more common. And we do normally pick this up at birth, which is the good news. Yesterday, I spoke to one of my patients who had this. She had both hips replaced. And she said she remembers vividly being in kindergarten and not being able to put her knees down when sitting cross-legged. So if as a parent you notice any of those things, just talk to your pediatrician.
Yep. I mean, I understand all too well.
Yep.
And I will say that during recovery, I have found there are days, less and less thankfully, but that the exercise sometimes felt like it might have been counterintuitive, actually making me go in reverse.
And you've done so incredibly well, and I think it's really a testament to the fact that right now joint replacement surgery is really better than ever, but joints don't last forever, and so it's really important to follow those recommendations the physical therapists and the surgeons give you as much as possible. When you talk about exercise, it's not just after surgery or post-op. As you said, it's before. So think of it really as encompassing 4 basic aspects. You want to hit the cardio, because that's important head to toe. You obviously want to build strength around the hip joint.
It's all about the core.
100%, and posterior chain, the glutes and the quads and the hamstrings. You want to work on balance, and you want to work on flexibility, because a lot of people with hip dysplasia, they have difficulty moving side to side. It's not just pain,
and they are telltale signs, and I had those signs. I just didn't know what to look for. I just didn't know.
I know.
And this is something that was congenital there my whole life, and there is a chance that it will be happening with my other hip, just because it is what it is. How do we help folks not be as shocked as I was? I mean, I went through shock symptoms when I found out. I was like, muscle pull.
So how to navigate those waters?
Yes.
Number one, I say find a good orthopedic surgeon. What does good mean? Someone who does a lot of this, who specializes in the hip joint. Just because you're an orthopedic surgeon doesn't mean you're a specialist in all joints. Right. You really want to follow his or her recommendations pre-op and post-op as closely as possible, and you want to minimize the wear and tear on that joint afterwards. Right. Because again, it has a shelf life. It's not gonna last forever, so that doesn't mean be inactive, but just means be careful.
And this is not an old person's problem. This is an active person's problem, and we all have joints, and they don't last forever, so please take care of them.
Absolutely.
Trust me. Dr. Jen, thank you. So much more information, and we've got preventative stuff coming up later in the week. We'll be talking with you, but right now, coming up, we're gonna get into The Walking Dead. Amy's very excited. Star Denai Gurira is with us live. We're gonna get with that next on GMA.